Good morning. I'm Michael McGinnis from the Institute of Medicine, and it's my great pleasure and privilege to welcome and thank you all for being here. On behalf of the Institute of Medicine and here in the National Academy of Sciences building, this is a truly remarkable brain trust that we've gathered here in the room, and we're going to try to extract every ounce of your very impressive capacity for the challenge that's before us. This meeting has a dual purpose. It's organized in the context of an IOM consensus study that is underway at the request of the Veterans Health Administration on the issue of optimal health care scheduling. The focus of that study, I emphasize, is for the nation as a whole, not specifically on the Veterans Health Administration, although obviously there are implications for every institution represented in this room, including the Veterans Health Administration. Secondly, it's to advance and inform the work of our IOM NAE, National Academy of Engineering, jointly sponsored Innovation Collaborative on Systems Approaches to Health, which is a major priority for us in the academies. Accordingly, we're doubly grateful to our chair, Gary Kaplan. Gary is in addition to being the meeting chair, he's also the chair of the consensus committee and the co-chair, along with Dick Larson from the National Academy of Engineering, of the Systems Engineering Collaborative. We're going to hear shortly from Gary after opening remarks from the president of the Institute of Medicine, Victor Zhao, who we are also very honored and grateful to have with us to kick off today's session, and a reflection of his commitment to advancing the interest of broader systems approaches to healthcare, the interest of ensuring that we have a continuously improving system throughout the nation. I want to just quickly go through the materials you have, just so you're aware of them. If you have your green folders, on the left-hand side are the materials directly relevant to the day, the meeting agenda, and Gary will be going through that with you later. The participants, your colleagues here in the room behind that, and the biographies of the various speakers behind that. On the right-hand side, you have the cover and table of contents of a discussion paper which is being developed in the course of the work of the study to inform the committee and to inform the country on some of the best experiences in various places around the country. We have a couple of the authors here in the room, Lisa Brandenburg and Patty Gabbo from Seattle Children's and Denver Health, respectively. Also, as co-authors of the discussion paper are William Rupp from the Mayo Clinic, Glenn Steele from Geisinger, John Toussaint from ThedaCare, and Bernard Tyson from Kaiser Permanente. So that will be a resource available to all of you actually fairly soon after the meeting. Behind that is a description of our collaborative, the Systems Approaches to Health, the Innovation Collaborative, the jointly sponsored NAE-IOM effort. And then behind that are three documents related to the committee work, the Consensus Committee study, including the Statement of Task, the committee members, Gary, who I've already mentioned, Jana Bazzoli from Cincinnati Children's Hospital, Jim Benion from Northeastern University, Jim Conway from the Harvard School of Public Health, Susan Denser from the Robert Wood Johnson Foundation, Eva Lee from the Georgia Institute of Technology, Eugene Litvak from the Institute of Healthcare Optimization, Mark Murray from Murray Associates, and also previously with Kaiser Permanente, Tom Nolan from the Institute for Healthcare Improvement, Peter Provenost from the Hopkins School of Medicine, Nursing and Public Health, and Ron Wyatt from the Joint Commission. Many of the committee members are here in the room with us today, and we thank them as well for their service and for their presence at today's session. In addition, we have here in the room Mindy Moran, who's the study director, and also from the IOM staff, Liz Johnston and Kate Burns, and I think Andrew Wong is somewhere in the room, as is Joe Alper, who's helping with the writing of the report. Before I introduce and turn the podium over to Victor, I just want to go through a few housekeeping issues. Also in your packets, you see a map of the wonderful building that we're in. And for those of you who haven't visited here before, please take some time to wander around. We're very proud of the building. We've just spent 3 years and a fair amount of money to make it look exactly like it did before, but with a little more gleam. That's actually not quite true. It's been embellished substantially, and I think you'll enjoy the tour. It also indicates where various facilities are as you need them. Wi-Fi, you do not need a password. All you need to do is click on the visitors indicator. For those who are Twittering, hashtag IOM wait times is the. I hope I said that right, because I've never done a Twitter in my life, but I was told by the younger staff that I should mention it. The permissions the presentations that you'll hear will be provided as soon as we have permission from all the presenters. The session is being webcast. And in fact, we have quite a few participants observing in the webcast. So please, when you make a comment, introduce yourself with your name and your institution. Without further ado, let me then turn the podium over to Victor Zhao. Victor is just past his 100th day as the president of the Institute of Medicine. He came to us from Duke University, where he was the president and CEO of the Duke University Health System. I won't go through his entire remarkable series of contributions, accomplishments, and experiences. It's listed in the program, but needless to say, we are very pleased to have Victor with us at the helm. With all this gray hair, I've watched a lot of people come into various loci in leadership positions. I don't think I've ever seen anybody hit the ground running as fast as Victor Zhao. Victor, it's a great pleasure to introduce you and to welcome you here.